building a nonprofit research group that holds companies accountable for the impact of their research projects that they might have on human health. He, before that, was the chief of research at GoodRx, the nation's leading resource for affordable healthcare, where he created GoodRx Research, a data research team that's published in a variety of journals, including JAMA and this one. Before that, he founded Iodine, which was a Webby award-winning digital health company that Time Magazine has called scaled for medicine. But that's not all. So he's also a journalist who's worked as a reporter for the Wall Street Journal. He served as executive editor at Wired, which has led to numerous awards, too many to list here. He's also the author of 2 books, The Decision Tree and a book called The Remedy, Robert Took, Arthur Conan Doyle, and The Quest to Cure Tuberculosis. His rating has been repeatedly selected for the Best American Science Rating and Best Technology Writing Anthologies. And he was also the first entrepreneur in residence at the Robert Wood Johnson Foundation. So I somewhat abbreviated his incredible resume. What I just learned, though, is that Thomas actually has a history here in Minnesota, and not just in Minnesota, but here at our WBOB. So I'll let him cover that piece, but thank you so much for joining us. I have a special present for you to say thank you for coming and giving at the seminar today. It is a souvenir WBOB glass.
That's lovely. That's very cool.
So thank
I'll
you.
fill it with water and milk only.
Very happy.
W Bob is the name of the building.
It is.
Okay, so my, as I was just saying, my father had his last office, I think, on this floor. He was a faculty member at the University of Minnesota for 40 years, 1950, 50 years, something, a long time, my whole life. And he was a professor of medicine and an endocrinologist at the School of Medicine, and then finished his career, as one should, with a ambitious public health epidemiological experiment or research project. And I'm very honored to have some people in the room who knew him or were
one of our all-time favorite professors, by the way. A wonderful man.
And I should say that's not all. I also my sister Laura Getz sends her best. She's a graduate of the School of Medicine. She's what is she now? She's a surgeon. No, she's not a surgeon anymore. She's she also has her MPH. Anyway, she works at Kaiser in Los Angeles. And my sister Cecilia quite proudly got her MPH here at the school, and unfortunately died in 1998 when she was working on her PhD in Uganda. But thankfully we have a scholarship in her honor, and thankfully there's some people in the room who were beneficiaries of that scholarship or awardees of the scholarship. So I could go on. My mother also, I should say, I have to say, she would be mad at me if she's also passed, but she was, she basically got her, she was a nurse she ran the Minnesota Visiting Nurses Association, which is, their headquarters was right around here. And she got, at the University of Minnesota, she got everything except the last credit for her master's in Japanese history. So, and why she didn't get that last credit is a story that it's too long and boring. Here we go. So it's, as I said, so it's a huge honor for me to be in this room and to speak with you. I had the pleasure of having dinner with some people last night, and I know some of the faculty last night, and I know that there are experts in the room who can be much more voluble about what I'm talking about. But I'm hoping that especially in these hours of angst and uncertainty with public health, that I can make one effort to point a way forward and to point towards what I think is a hopeful framing of work and reminding the world by public health matters. Okay, and so own the outcome. Does that make sense to people? Own the outcome? We'll get there. Okay. So this is again what I do, who I've been. All of it though really was all of it changed when I got my MPH. I was as Rachel was saying, I was a diehard journalist, but saw the writing on the wall of the future of journalism, and so decided to get my MPH while I was still at Wired, and that really reframed my thinking. And so I wrote my first book out of the work I had done at Berkeley, and it was called The Decision Tree. And what I saw was this kind of combination between digital technologies, which were able to change industry after industry by bringing innovation at scale. I saw that lined up with the notions of public health, which is to change and improve health at scale. And so my hope was that digital technologies could come to health and healthcare, but not just healthcare, but also health, and help people understand their needs and status, and that it could empower a new wave of better decision making, not just on the part of patients, but on the part of people before they become patients. So it was this whole idea. It was a bold vision, and it resonated a lot at the time. This was 2010. It came out. But as I went forward and eventually a couple of years later started this company Iodine, which was really built to serve this principle of giving people better information to drive better decision making. In the case of Iodine, about medications and which medication might work better for them. What I came to realize was, what should be self-evident to all of us in 2025, giving people better tools and data doesn't change population level health, because it's really hard to expect individuals to change in the face of society. That's public health 101, but it took me a few years to kind of really have that lesson come home, because this incredibly ambitious vision for digital health in 2010 has now become really a industry about better insurance billing and better kind of care for chronic conditions, which is not what my vision was. So if you want to put it into a meme, it was this, right? That despite what we saw as this need, Fitbits alone, smartwatches weren't going to do the trick. So I was left with this question, which was why do we keep on going back to this framework of individuals trying to, putting the onus on individuals to change what actually is much larger social forces. Yeah, I got to speed up here. So I'm going to break it down into 3 sections. My talk is going to first talk about this problem and how it has, what's the problem, and then talk about some precedents for change or addressing that problem, and then really trying to dig in a little bit to how do we put that in action in public health. So the problem. We know the problem. It's our rates of chronic disease are going through the roof. This is obesity. This is diabetes. But the behaviors that are manifesting in these problems are these, right? They're these things that all of them are going in the wrong direction for so many people. And they really are behavioral. And so the question is, well, why do we kind of get, and we were talking about this last night at dinner, why do we want to stay indoors? Why do everything's so convenient and easy these days? If you can just do it all from home, we can even work from home. So what's going on there? Although I should say they manifest in these chronic conditions, what I call the plagues of modern life, what other people call diseases of modernity, diseases of civilization. There's lots of names for these groups of conditions. But the bottom line is that we, all of us and other people, have created a society where it's just hard to be healthy, right? If you do the default, you might, well, probabilistically, 70% chance that you will end up obese. 30% chance that you're going to end up with type 2 diabetes. Now, those chances are better if you're well off, but it's still a difficult game to play. And I can say this here, this is a more controversial slide when I have doctors in the audience. I don't know, Baron, you maybe want to MD. Yes, of course. Sorry.
That's okay, I'm with you.
But healthcare is not the answer. We spend $4 trillion already on healthcare, and it isn't solving the problems. So, so what is the typical paradigm, even for public health? Well, healthcare is part of public health writ large. We try to address it there. As I say, it's too late. We do ask people to change their lifestyles. We ask for them to use the Fitbits, and that is not effective, as I've said. But most of what public health looks at often is policy, policy frontier, which, as we all know, is incredibly problematic today. But also, I would say, is a small wedge in the face of this kind of, I'm going to mix my metaphor, is a small beam of light in the face of this massive cloud of social inertia. So what I'm going to propose today is that we think about where the problem is actually happening, and it's in the consumer environment. It's in the products that we consume or that people consume every day. Our product environment, that's this term that we use to try to, it's analogous to the built environment, but it's all these things, right? It's all these products that we use. I'll share another meme for you. I don't know if you remember this. It's probably out of date, this meme, but this was the cargo truck or cargo ship that was stuck in the Suez Canal. I think it was the Suez Canal. Anyway, we're up against a massive force. In academic circles, they call this the commercial determinants of health, which I'm sure, how many of you are familiar with that term? Okay, not as many as I would thought. So commercial determinants of health is this emerging body of research. The number of papers written about it have really taken off in the last 3 or 4 years. If you want to bone up on the academic context, the Lancet has done some exceptional work on it. They did this big series a couple of years ago, but it's very analogous to the social determinants of health, but really, again, talking about this corporate context of commercial actors, the commercial environment. But you don't have to, sometimes that's an academic context, and I realize we're in an academic building. But really, it's the notion that there are many products that are, or at least my argument is that these are products that are brilliantly designed to be, not just to be bad for us, that isn't the intention, but the intention is to maximize consumption, because that's where all the incentives line up, is to maximize consumer consumption. So let me just give you some examples. So this is a Pizza Hut product. You can eat it any number of ways, but this is an example of what we're up against, right? They have designed foods, they have engineered foods to be so irresistible, and we eat them even when we're full, right? You keep on eating because it's fun. And when you think about that kind of workshopping, I don't expect you to dig into this slide, but this is an example of AI now coming to the food development industry. Major companies are using AI to plunder our brains to figure out what is the best way to design foods such that we can't resist eating them. When you think about it as a fight, we're up against some really sophisticated technology. Again, individuals are expected to take all of this on. If you think about another context of our transportation system, we have now just created a world of living rooms on wheels. This is a chart of the best-selling cars last year, and the salmon bars are the pickup trucks. So the biggest selling cars these days are pickup trucks, probably even bigger in Minnesota. It's bigger in California, I know that. Okay, and then our entertainment, right? So what I say here is free will is a friction. It's also a fiction. It's a friction in the sense that it is an inefficiency that the companies want to do away with. So we have here the autoplay mode, which is the default, right? So the default when you look at Netflix is that it has a 5-second timer when this episode ends. And you have to click on that within 5 seconds. It's actually really hard, and I know this, that it's really hard to click that within 5 seconds because you're like this, and all of a sudden you need to kind of find the remote. So it autoplays, and you're on to the next episode. Not only that, but they know through the database of billions and maybe trillions of hours that people have watched other shows, they know how to write the show such that it ends on a cliffhanger and you want to watch that next episode because it's irresistible. And so, and there's a reason, that's why Netflix releases a whole season all at once, right? Because they want you to binge. The former CEO of Netflix, Reed Hastings, said that their biggest competition is sleep. And he wasn't joking. So that's what we're up against. This is what is this? The Perfect Couple, I think. Does anybody know what the show is? This is the new Perfect Couple. So if you look at it, it's 6 episodes, I think. I just went to the last 20 seconds of every episode, and it's even not just watching the last 20 seconds, not watching the previous 45 minutes. I wanted to see what happened. It's a cliffhanger. It's perfectly designed. Anyway, it's a fiction. So it's a fiction in the sense that I don't actually believe that we have free will as consumers when we're up against this, right? So we talked about this last night at dinner. Individual choice, we're just giving people choices. That's what they say. But they've actually designed these things such that we aren't really using our free will. There is no capacity. Oh, and this is just the time consumed this is just digital entertainment. If you add the red and black bars, you see that it's gone from 6 hours and 15 minutes a day spent watching entertainment to almost 7 hours in the last 5 years. So that's just going to keep on continuing. Doesn't matter what the distribution between red and black is. It's the cumulative one that I find so concerning. Okay, put it all together, and you've got the citadel of modern civilization is the drive-through, right? It's not the High Line in New York City. It's not the Bilbao Museum, or I guess I should say the Weissman Art Center. It's the 4-lane drive-through that has not only food, but if you see each food that's packaged with entertainment, right? It's Minions, it's BTS, it's these combination packages of food and entertainment that make it so irresistible. It's not just one behavior going on here, it's many behaviors at once that are not healthy. So if I convince you that this is a problem, okay, I'm going to say that yes. So what are the precedents for change? Well, the precedents for change, let me start with a quiz. How much does a Burger King Whopper meal cost? You can admit it. Somebody can admit that they might have a sense.
$10. $8.
$10? Okay. So 7, 8, somewhere between $7 to $9, $10. Okay. In San Francisco, it's $14.29. I know. In Minneapolis, it's $11.09. But so that's the cost of a Burger King Whopper meal. But let me just rephrase the question. What is the cost? Not how much does a Whopper meal cost, but what is the cost of a Burger King Whopper meal? You understand the difference? That is much more than $11.09. That's something that we should try to quantify. That is the externality. What we're talking about is, for those of you taking your health economics course, and if you haven't taken it, it was the best course I took in my MPH. Externalities are all the costs that are not borne by the cost of the product, right? The classic example is, this is a market failure, it's a tragedy of the commons. The classic example is cigarettes, right, or pollution, right? So there's when there's a pollutant and all the stuff emitted in the air, traditionally the polluter, the manufacturer, doesn't pay for the emissions. So we try to fix that. This is what it looks like if you're in your economics class. I won't walk you through it, but it's a distinction or a difference between the overall cost, which is the marginal social cost, and the private cost, which is the $11.09 that you pay. But again, when we think about externalities, when people think about externalities in economics and health, we usually think about these industries, right, or these products. There's cigarettes, there's heavy industry, there's automobiles. Agriculture has a lot of externalities in terms of water pollution from fertilizer and overuse of overgrazing, things like that. Those are externalities. Fossil fuel industry obviously has massive externalities. That's probably the best example. And then plastics, which is we're only reckoning, public health is only beginning to reckon with what those externalities are vis-a-vis microplastics and other risks to health. So my argument is that this offers externalities in other industries. These have all been fairly well measured and efforts to address them. So how do we bring them to public health? Well, let's just look at the patterns. Let's look at the process by which these other industries were addressed. It takes a lot of work. Tobacco, as many of you know, as there are, again, experts in the room who know this better than I, it goes all the way back to the origins of public health. I'm gonna get this wrong. It's Hill and Dahl, right? Yeah, thank you. Woo! Okay, so Hill and Dahl in 1947 started the research that that was showing that smoking was actually the cause of lung cancer. It took 15 years or more for the Surgeon General report to come out in 1964. That was the first kind of what I would call a regulatory effort to try to steer policy in and into different behavior. But it really took until the 70s and 80s, and then the research into secondhand smoking in the 80s and 90s to change social norms from making smoking that was something cool to something that was actually not only uncool but also detrimental to other people in the room. It was taking away other people's liberties. So and then it took the 18 attorney generals of different states, something like that, 18, to come together to sue. Anyway, it was a huge effort. It took decades. It was a multifactorial effort until we could finally start to capture and charge the tobacco industry for these externalities. Carbon, similarly, the actual understanding of carbon fuel being emitted was started in the 60s, but it took years before the industry was being held accountable. Importantly, what I want to note vis-a-vis carbon is that one of the important parts of the argument against carbon was developing other alternatives, right? Because we weren't trying to tell society that we can't manufacture things, that we can't use energy. Our society has an appetite for X amount of energy, and so we need to provide X amount of energy if we want to continue to have the daily life we enjoy. But there might be alternative ways to create that need, which is solar, which is hydro, et cetera, et cetera. But it took decades of technological development to supplement that energy need. Again, so decades and decades of work. Overfishing is a great example in terms of the ability to capture externalities, because it's a classic tragedy of the commons, right? There are all these boats going out there. How do you track them? How do you know what they're doing? They're plundering the seas. It took decades, and actually only in the last 20, 30 years has there actually been an effective framework for actually motivating those individual fishing boats to change their behaviors. So again, it takes a lot of work. So what I'm trying to get at here is there's a accounting phase. There's a phase where we measure what is happening. We measure the externality. We measure the cost. But then we need to transfer that into an accountability, which is actually holding the industry to account and trying to actually balance the lack of balance, the disequilibrium between cost and between cost of product and cost to society. And to move from accounting to accountability, first, the most important thing is to quantify that impact, right? The accounting. It's so important to do the math. And I'll get into a little bit about how we can do the math. But then then you see the kind of the regulatory step where the math exists and you're able to go to regulators, you're able to go to government traditionally, and say, this is a problem, we should do something about it. And then as the regulatory edifice starts to move, as I say, you need this kind of industrial evolution as well that needs to be concurrent. And then ultimately you need to create not only alternatives for consumers, but actually ideally some consciousness or understanding from a consumer level, from the level of overall society, that this is an issue that we together need to address. And you can read my notes. But that's generally a framework for turning this measurement, this idea of measuring externalities into change. And here is maybe where I say that traditionally, public health as a framework for research is very good at the accounting, but not as good at the accountability. Which is to say, a lot of what public health does is scold. It creates a body of evidence, and then it says, especially in the commercial context, and it is hostile to industry. And that's all well and good. Well, not all well good. To us, I'm making a radical assumption here. To us, we probably all agree that it's good to hold the firearm industry accountable for the cost of human health. Maybe we don't all agree on that, but tobacco, there are certain ways that, you know, we think these are bad industries. But there are many industries outside of these that actually have an impact on human health. And as we start to move outside of what most people would consider, or many people would consider, bad actors, it becomes harder to just scold and expect anything to happen. And that's what I mean by accountability. If we really want to move towards change, we need to do more than just do the math. So what do I mean about going outside those industries? What about those industries? What about these industries? What about the fast food? We just think about fast food as a kind of paradigm. Again, this is where I think a lot of the problems of everyday health for most people, where a lot of the causes of chronic disease that we are afflicted with happen. So how do we measure, how do we take this framework of externality and accountability to these industries? Well, I want to give a couple of quick examples of how this has been done so far. Ride sharing and Waymo, which is, if you ever come to San Francisco, you can take a robot car. I always make my friends do it whenever they visit town. It's freaky the first time, and then it's just normal. But you guys are reading the first line. Waymo is empty 55% of the time. It's just driving around. And you see this as a citizen of San Francisco, like myself. Sometimes I'll be driving my kid to school and there are 5 Waymos on the block. And it's the only other vehicle on the block other than me, and they're all empty. And so that's what happens. So what happens is it's starting to be modeled, it's an increase in congestion, and then it doesn't calculate the productivity costs, these are other externalities, right? Even better example is from the Minnesota Department of Transportation. A study came out last month in March from, I'm gonna rub your nose in this. 2 researchers from Hong Kong used data from 8 miles away, the Minnesota Department of Transportation, and they were able to see that from 1995 to 2019, there was a change in cars. This actually, they looked at car registrations in the Twin Cities. And then they were able to look at sensor data from the highways from there, right there. And what happened over those, and they stopped in 2019 because obviously in 2020 with COVID, traffic patterns changed. But what you have is this huge shift over those years from the kinds of cars that people were buying and driving on these freeways. It went from 1/3 cars, or 1/3 trucks and SUVs, to 2/3 cars, trucks, and SUVs. And what happens when you put more SUVs on the road is they're bigger, heavier vehicles. And so they need more space in front of them when you're driving it. So you need more distance so you don't run into the car in front of you. So there's a little distance there. And then if you're behind an SUV, well, it's harder to see around it. So you lag back a little bit. And you compound that and you get a 15% slower traffic. So that's the externality that, and I have a pickup truck, so I'm guilty of this. But that's the externality that I'm putting on society, that 2/3 of drivers are now putting on society. And again, this is Minnesota data. Okay, so what do? I want to run through two efforts that I've been involved with where we're trying to basically really factor in or calculate these externalities. First is does this make sense so far? I'm going to pause here before. Okay. Any questions? There'll be time for questions at the end, but I just want to be sure there's no confusion. Okay. So so at my research nonprofit Building H, we have tried to break this down. So we have looked at these four industries. We focus on these four industries: entertainment, food, housing, and transportation. And we've tried to see, well, what is the health impact of the product environment? And so what we do is we rate the companies by their impact on these 5 health behaviors. We look at sleeping, we look at social engagement, we look at just getting outside. That in and of itself, not exercising, but just going outside is highly correlated to positive health. Obviously, eating healthy foods and then physical activity. 5 health behaviors, 75 companies, and we try to factor in, we rate each product, not the company, because some companies have lots of products, like Apple has lots of products. So we can rate Apple TV, but you aren't rating the iPhone. It's actually interesting, the iPhone, this is a tangent, but the iPhone is a great example of a company that recognizes that product is really bad at all these behaviors. And so Apple has actually into the iPhone iOS, they have programmed nudges to move you towards a more positive behavior. So they ask you if you want to create a sleep alarm, right? Like, who has a sleep alert telling you it's time to go to sleep? Really? It's a great little thing. You just say, yeah, I know. You just say it's time to go to sleep. Okay. Yeah.
I used to, but I violated it so much.
Yeah, that's true. It just makes you feel bad.
I'm embarrassed about that. Thank you for.
It's true. And then there's a great app called Nature Dose by a company Nature Quant that measures how often you're actually outside in nature. Eating, obviously here, right here, there's great data available around how healthy your food is. That's a hard problem, translating what's on your plate into. So yeah, I shouldn't say anything. There's an expert in the room who knows everything about that. Anyway, there's a lot of things, a lot of ways that Apple iPhones are trying to cover program this. But what we were doing was we were measuring companies' products based on these 5 health behaviors. An example, so it was there's a formula, an algorithm that we had, but basically you rate them on these behaviors on a scale from -3, which is bad, to +3, which is a good influence. Because some companies, I should say, there is such a thing as positive externalities, positive behaviors. And so you want to give credit where credit is due. But a company like DoorDash, importantly, and they're even like something like fast food or like DoorDash, you think, oh, it makes it easy to get bad food or food that's not good for you. But it's not just that one behavior. It's this compounding of many bad behaviors. So not only is it easy to get low quality nutritious food, but it also creates more social isolation because you're not going outside. Obviously, you're not getting outside, so you're not getting outside. You're not getting outside, so you're not getting physical activity. And it does induce slightly this kind of tendency to not go to sleep because you would rather snack. Just a tiny bit. So we had this we crowdsourced this rating. We had over 400 raters in overall. all of whom had a public health or medical background. And then out would pop a score. It was a 0 to 100 score, largely 50, well, I'll show you the results. 50 and above is a kind of a net positive, and 50 and below, or 49 and below is a net negative. And you can see Netflix scored the worst, because as I showed earlier, it's so well designed to induce bad behaviors or behaviors that in massive quantities are bad for us. It's okay to watch Netflix. It's just not good for us to watch 7 hours of Netflix a day. So this is our index. We published this in October of last year. It's a 100-page report. We developed it in partnership with the Stanford School of Medicine. They helped us with the methodology. Actually, Sarah Singer, who spoke here a few months ago, right? Just a few months ago.
About a year ago.
Yeah.
Or in the fall, yes, right.
Right. So she is one of our. You came to that lecture. She's awesome. She's a rock star. Okay, so that's that approach. That was comparing different companies and products among themselves, really. So we had this index that you could make some relative assessments. But there's also kind of going back to this idea of how much that Whopper costs. We can start to think about, okay, well, can we quantify on any given product what the cost of that product or the company that manufactures that product? What is the cost borne by society? And this makes sense, right? Like, so what's the cost of, well, how much disease is attributable to DoorDash? How much hypertension, how much does our blood pressure rise because we're stuck in traffic for 20 minutes more, actually, yeah, 20 minutes more a day. So that was a question we had. And thankfully there's, so sequence from my slides, but anyway, so what is the cost of that Whopper meal? Well, the question becomes, okay, what are we going to measure? How are we going to measure it? And then how do we translate that into dollar terms? Well, thankfully, public health has the answer. There's this methodology called population attributable fraction. I have to ask how many people are familiar with this. Oh my God, that's amazing. I did this at Berkeley. I showed this slide at Berkeley a couple weeks ago and I had like 4 people. So you guys are way ahead. Okay, well then I don't even need to tell, well, I'll just, tell me if I'm wrong. But it's basically, it's largely a way to calculate exposure to something negative, right? So like a pollutant or what's an example of the way this is conventionally used? Anybody? Yeah, go ahead.
You could say the proportion of deaths in the population that are due to a particular exposure. So,
Like what's an exposure that you use?
so 83% of
Oh, right.
lung cancer.
That's a great example. That's such a good example. You had that stat right off your head.
Yeah, it just came to me.
Okay, thank you. Anyway, so the idea was, okay, can we take this framework and bring it to all these other companies? And then can we translate it into cost? And this is kind of drilling down a little bit into the nickety-nick of every step. But so going back to Burger King, well, it turns out that you can measure this because food is actually a pretty highly regulated industry, and because these are largely publicly traded companies that tell you how much they're selling, you can do some math. And so you can quantify that about 0.4% of the US population eats Burger King as a significant part, or that's actually more people, as an overall part of their diet, right? So like in aggregate, 4.4% of the calories consumed in the United States basically happen at Burger King. Does that make more sense? Because probably 50% of people go to Burger King during the year. Sorry, it's got blocked off by my slide. Anyway, so when you eat a lot at Burger King, you get exposed to a lot of sodium, a lot of sugar. also a lot of calories, but we didn't actually, calories become a little more difficult to be probabilistic. So we actually didn't even count calories. But then you do a relative risk. You basically say that, okay, if you have this high sodium, what is your increased risk of heart disease? And then thankfully, we have a well-documented statistics on our percentage of people with cardiovascular disease or type 2 diabetes due to those exposures. And you can actually quantify cost because there's been really good modeling on what the cost of a patient with diabetes, with type 2 diabetes, costs about $10,000, $11,000 a year in healthcare costs in the United States. And high heart disease is about $8,000 a year, things like that. So those are quantified. And so you put all that together in your spreadsheet, and you come up with, depending on the relative risk, so that's the big swing of variable, but you get from somewhere between $1.5 billion to almost $7 billion a year that the US spends in healthcare costs because people are eating at McDonald's. What do you think? Is that what you would think, or is that more, or is that less? Nobody has an opinion. Yes.
High for one restaurant exposure. Now imagine doing this across all the fast food restaurants.
Exactly. I do imagine that. I would like to do that math. And I want to do that math. I think it also is high, but also I don't think it's high because Burger King's revenues are, I don't know, $30 billion a year. I'm totally making that up. I have no, somebody can Google it right now and find out. Yeah.
Just wondering, you actually have two products on your picture.
Oh.
Because Coca-Cola wouldn't that be a different product?
Yeah, so we do it as the meal.
Okay.
So we do it as, so what we looked at is somebody Googling the annual revenue of Burger King? I'm serious, I would love to know that. We look at, if you look at the order, the menu at Burger King, we can't discern from the outside what people are actually eating, but we can, what our presumption is that the featured meals are what most people are eating. So we use that as a proxy for the overall, so whatever it is, who has the revenue for Burger King.
27 billion.
I was pretty close. I was pretty close. So $30 billion a year. 23.
That's from 2023.
Oh, 2023.
Yeah.
About 30 billion. So that's only, if you think about that, Mark, that's only somewhere like, what, 5 to 10% more than their actual revenue. So it's plausible to me that it's that extra cost, right? Anyway, so that's what we do. We look at the meal, and then just you can break out the so that meal, the calorie or the sugar content in the soda and the sodium content in the fries and the burger, et cetera.
I think the prevalence, the 0.4, I don't know how you calculate it, but you didn't count calories, and that's can come from other unhealthy diet, like the communality, as we know in the population attribute fraction, is important, and I don't know how you calculate that.
Yeah, and I have my spreadsheet, but I'm not gonna pull it up right now because I don't know. It would be confusing to me too if I just try it all up. But I know we had smart people do it. So, but it's a, I mean, yes, you check your math, like definitely if you're, and we're in doing this, we haven't published this yet. We haven't gone public with this yet. One of the thoughts that we have had is when we do publish this, are we gonna get sued by Burger King? And so we wanna be sure our presumptions and our math check out. So we'll double check our math. But I think, it's pretty solid. Okay, any other questions on that? You had a question?
Oh, yeah. I was gonna ask, the odds of somebody who eats Burger King on a regular basis. I feel like it would be high that they would also be eating other fast food chains.
Yeah.
How would you show that through graphs to show that Burger King has more of an effect than like McDonald's if they kind of both have similar effects?
That's a great question. And I'm gonna say If I was a student at a school of public health, I would think about a way I could solve that. So that's what I'm trying to do. What I'm trying to suggest is that there's this whole framework of analysis and evaluation. It's, again, just like the Minnesota Department of Transportation. It is data that is in your lap. And this is a level of inquiry and a direction of inquiry that is available to anyone. And unlike tobacco or fossil fuels, this is stuff that all of us kind of reckon with and think about and consume. I mean, we consume fossil fuels, but we don't think about it necessarily. But this is stuff that actually is resonant with our everyday life and everyday choices. So, I'm gonna wind up here. But so this is the kind of like, there are a lot of questions about like how we turn this data into actual action. So it's not a good time to expect for more regulation from the federal government. We are working on bringing this data to what are called socially responsible investors, like ESG rating. But ESG, there's a lot of pushback politically these days from ESG, so that's not necessarily a fruitful direction. There's B Corps, there are consumer engagement. There's a lot of directions and things to do to move this forward from just a Hammond. But again, this is a map that we need to fill in. This is you can think of it like uncharted territory, and we're really trying to fill in the map towards effective accountability. I'm going to leave you with this quote from Buckminster Fuller, who again was a frequent. Does anybody know Buckminster Fuller? One of the great inventors of the 20th century, most famously invented the geodesic dome. He was a frequent visitor to the School of the University of Minnesota. They, in fact, in the 70s, he spent he actually spent many weeks or many years as a guest at the School of Architecture. But he was so important that Rudy Perpich, the governor of Minnesota, had Buckminster Fuller Day in I think 1978 or something. So he's a hero of mine. My youngest child is actually named Buckminster. We call him Buck. But he was onto this decades ago. He really saw that we could build a different society. I mean, the geodesic dome, if you look at it, it's a crazy, goofy looking thing. He expected people to use those and to build those and to live in those. That didn't happen, but he had a vision for the way people could live differently. And I think similarly, we in public health should have a vision for the way people can live differently. And not because we just tell them to, not because we expect them to do better, but because we make it the way they want to live. And so that's what we're trying to do. And I think that's what I'm trying to suggest to all of you, especially students, that this is, especially today, right now, this is fertile area for exploration. So thank you very much.
Thank you so much. So question time. Andy.
Thank you for that talk. It was interesting. I have two questions, kind of related, about what you see as the kind of end goal or where we go with this sort of analysis. And the first question is, do you see this used in your imagined kind of idealized version, similar to how 3M has had to pay people here in Minnesota for contaminating water sources, like where companies would then be asked to provide like payback society? Similar related question is like, how do we use this? Like, should we be acting as marketers to make certain products that score higher seem cooler? Or like, what is the goal when we're trying to reach a consumer?
Yeah. So so the first thing, our first goal is great question. Our first goal is for actual companies to build healthier products, which seems crazy in light of all this, but we really do have this vision for products, a product environment where the more you use, the healthier you get. Which is not the way it works right now. Now, the more you use of so many products, you get less healthy. But what we'd like to do is to change, there's this assumption in capitalism that that companies can only drive towards shareholder value. They can only exist to maximize profits. And actually that is a kind of crutch that corporate America relies on. Well, we're just giving people what we want. We're just trying to maximize our shareholder value. That is a fallacy. I think Minnesota actually is a great example of why that's a fallacy. If you look at the history of corporations in this community, they have seen a responsibility towards their community and towards their neighbors, such that it's not just about maximizing shareholder value, that they want to give back and contribute. We want that to be not just a local phenomenon, but actually a part of their overall calculus of how they make products. And so we're working with designers and builders, and especially in the tech world, to think about how can they build healthier products. How can they create defaults so that, like Netflix, so that autoplay is not a opt out, but it's an opt in. Those little decisions, those little product decisions, are incredibly important and incredibly effective at changing behavior. The second question, actually, I was getting into it then. So consumers, again, I think we should only expect certain kind of high resource consumers to be able to make those choices consciously, right? We don't all have the latitude, aptitude, resources to override the defaults. So how can we make those positive, healthy decisions easier? And how can we make those decisions the defaults, or those healthy paths, the default paths, so that consumers may be aware that they're on a healthier path, but they're not doing it at the expense of some of these other urges. And it's a hugely hard problem. Like the human body, all of us, we want to, like our biology is telling us to eat more salt, eat more fat, stimulation, dopamine, all those things are moving us in some ways in the wrong way. So we have to think about other systems and structures to put us on different paths.
Do you have any kind of comparative data from other countries? This is all US based. Have you looked at other countries, their policies?
Yeah, so all the data we use is, I mean, we're all the modeling we're doing is US based. But what I'm picking up from what Fred Armisen said on Saturday Night Live a few years ago, our greatest export in the United States is diabetes. So every other country is following in the footsteps of what we're doing. We're exporting our behaviors, we're exporting the foods and systems and structures. So we haven't done we haven't done the math outside of the United States, but hopefully if we have resources, we could. But we think these are problems that are by no means isolated to the United States.
I don't want you to get sued by Burger King either, but when I was thinking about, I think the FDA or some group was talking about changing the measurements of sugar on food packages from
Yeah.
grams to teaspoons, and apparently the sugar lobby got really super mad. To me, as a consumer, that exposed a real weakness. That was a aha moment. So I wonder, to some extent, again, I don't want you to get sued, but if you did, would that be kind of a positive for changing corporate behavior?
Yeah, I mean, sure, yes. I would be willing I would be willing to fall on that sword. What you mentioned though is a great example okay, so when the USDA suggested changing the food labeling, and relatedly, they also recently suggested changing or proposed to change the definition of the word natural or healthy, and they created limits of 5 grams, anything had to have less than 5 grams of sugar per portion and less than some level of sodium. So it's just those two constraints that they put on using the word healthy on the product. And the food industry went insane. They, during the couple, I went through all the public comments. I'm probably maybe one of the few people in the world who did that. And I read all the comments from all the food industry, and they were livid. They were arguing about First Amendment rights and all this stuff. It took years, but they finally pushed it through and they changed the rule. And it's been in effect for a few months now, and they modeled how much change in behavior that is going to do, and it is infinitesimal. Like there's almost no expected change in consumer behavior or consumer benefit based on those changes. So you're absolutely right. These are incredibly contemptuous fights when we pose to kind of hold people accountable and stuff like that. But I think we need to do a lot more of it. There are a lot more fights that we need to pick if we really want to manifest change.
So, if you don't mind, I have one question for you. So, from your perspective as a former editor of Wired magazine and a resident of San Francisco, since January 20, are we recording this?
Yeah, I am.
Okay, anyway, since January 20th, I feel like there's in the public been a reexamination of how we have thought of tech culture and how we've glorified that. And a lot of the companies that you're putting on here were, I'm sure darlings of Wired magazine. And so I was just wondering how your perspective on how journalism and reporting and sort of how we present these companies and the culture around them sort of goes along with what you're talking about. Because I personally feel like a piece of building all this up has come from that and sort of this idea that we had that, a lot of these companies could lead us to the bright, shining Star Trek future that we were all hoping for.
Yeah, well, so I agree with you. I mean, I was part of the wave of optimism in the early 2000s when social media, or what was then called Web 2.0, started to emerge. And the idea was that it was going to connect us, right? It was like Facebook was a way to create time well spent. And that it was going to make all these connections, and it worked for a while in certain contexts. But if anybody's a member of Nextdoor, you can see how quickly those connections, even in a localized environment, can turn very sour. And so there are certain dynamics where whenever it doesn't work as we had hoped, and then you combine that with the profit motive and the fact that these are massively successful companies that have, it's relatively, since they're technology companies, it's relatively easy to turn the knobs to induce certain behaviors. And you've seen that Facebook has been, people have gone public exposing some of these, the inner data that they've had and the knowledge they've had. So I mean, say we were wrong, and I'm happy to have that be on the record. We were wrong in many ways, but that doesn't mean that we shouldn't keep trying. Again, people want to use these tools, right? Like teenagers love these tools. They love Instagram. Older people love Facebook. We still all use them. If you're a young person who uses Facebook, God bless you. So I think we just have to keep working to make them better, because they're not going to go away. And even if in some weird world the FTC breaks up some of these companies, it's not going to change their existence. And when you start to layer in AI, that again, as I try to hint at, it's just getting better and better at beguiling us into more and more use. We just have to keep vigilant.
Well, we are at the top of the hour. I just want to say thank you so much for coming to our.
That's my honor.
That was super interesting and super thought provoking. We have a PhD seminar class in here in a few minutes, so I'm gonna ask everyone who's not a PhD student to sort of slowly clear out so that the PhD students can get set up. But if you want to linger a little bit, that's okay. Thank you so much.